I know there are many of you that are thinking this is way too early to talk about clinical research. I'm going to try to make it like pulling off a Band-Aid, quick and painless. But I am going to take a few precious minutes to tell you a little bit more about myself. I actually was born in a very small town in India, in Ajmer, in the province of Rajasthan. And my dad was a railway physician. So basically, we lived on a railway car, and we would go to all of these small towns, and the villagers as well as the railway employees would come, and my dad would treat them at the railway station. And what my mother tells me is that I actually learned how to walk on a train. And that concept of motion and on motion and balance with motion is probably it's a skill that I am tapping into more today than any other skill set that I have or any other training that I have had so far. So I'm going to talk to you about the Canadian clinical research, Forging a New Path. And Russell has done a great job of setting me up in terms of my presentation. I'm going to skip this. You already have heard about the tough business environment. And I'm going to go through this very quickly because you live this environment. You don't have to be told. But the number is staggering to me. $63 billion will be lost to patent expiry by 2014. 63 billion. This is a slide that I would like to spend a little bit more time with you on, and it's about research and development and the cost that we're experiencing these days. If we're losing as many compounds to patent expiry as we are, how do we fill that pipeline? It's only by doing research and development. But you can see that we have less money coming into the corporation, and yet the cost that we have in terms of delivering the compounds have increased quite tremendously. I realize I need glasses and I can't see those numbers, but essentially for $17 billion you could get 53 new molecular entities. And now it has flipped almost completely the opposite. And for $47 billion, you can only get 17. There's a whole lot of pharmaceutical companies out there. We're all fighting for that 17 new molecular entities. But look at the amount of money that is being spent out there. So why is investing in Canadian R&D important? And I think that it's the reason that I'm here, is to tell you that we have agreed to spend a certain amount of money in Canada in order to have the patent protection that we enjoy. So we have said that we will spend 10%, and we've been spending around 8.75% certainly last year. And I'll tell you, the generic companies are really utilizing this against the name brand pharmaceutical companies. It's also the largest component of pharmaceutical industry investment at an institutional, provincial, and at the national level. It is what we use all the time to say, we are important, pay attention to us, we give something back. So we can't minimize the importance of it. It's a key factor to government negotiations. We talk about the benefits of innovative medicine and the benefits to the patient, but we also say that we provide jobs and a large amount of investment within Canada. It's what we use for shareholders, for KOL. You use a lot of the early work we use that to create the key opinion leaders that we need. I know that sometimes it looks like well, there's a lack of clarity as to how decisions are made about where clinical trials are placed. And you think that it might be more complex than it really is. It's based on just 3 simple principles: maintaining quality, low cost, and speed in terms of getting an answer. That's it. Nothing else. It's not an emotional decision. It's not about really about expertise and those kinds of things. You have to be able to do meet those three criteria. The Canadian environment, quality. We've been playing the quality card for a very, very long time. We've been saying, yeah, we know we're expensive and we know we take a long time, but we give you such immense quality. Well, guess what? The rest of the world is catching up in terms of quality. In terms of cost, we're incredibly expensive. There are lots of people that say, well, we're not as expensive as the United States. We are. We're actually more expensive on a per patient or on a per data basis than the United States. And certainly, I'll talk about India and China in a few minutes. One of the numbers that I want to bring to your